This week on Africa Health Check.
There are many rumors about that vaccine.
We discuss how best to use technology.
Specifically on peace building, we're focusing on mitigation of hate speech and social media incitement that can lead to violence.
To tackle misinformation while fighting the COVID-19 pandemic. And welcome to Africa Health Check. This is where we reflect on Africa's response to the COVID-19 pandemic. I am Khokhontlejang Paladi. On today's episode, we will be discussing the use of technology in tackling misinformation during COVID-19. But before we do that, let us have a look at Africa in numbers. This week on Africa in Numbers, we look at the Africa CDC report on vaccination rates as of the 13th of February 2022. According to the Africa CDC, only 11.69% of the continent's population is fully vaccinated, with approximately 16% of the population being partially vaccinated. Seychelles leads the way with 78% of its population fully vaccinated, followed by Mauritius at 71%, Morocco at 62%, Rwanda at 55%, and Botswana besting Cape Verde for the top 5 African nations with 46% of its population being fully vaccinated. For more on these African statistics on the COVID-19 pandemic, go to the official Africa CDC website. And that is our Africa in Numbers segment for this episode. And as I've already said, we will be discussing tackling misinformation about COVID-19, but using technology. And to help me with that discussion, we have our special guest for this episode, Mr. Achaleke Christian from Cameroon. And as usual, we have our commentators, Dr. Marianne Morathi, who's the current chair of the Department of Medical Microbiology and Immunology, and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pastor and a pharmacist from Ghana. But before we hear from these experts, let us have a look at this week's feature.
My name is Emmanuel Obijo. I'm based in Juba, South Sudan, particularly from Eastern Equatorial State. I'm a social entrepreneur and an activist. I am pursuing Bachelor of Political Science at University of Juba. Back in 2016, I started a national organization called Union for Penny Space, which is a national non-for-profit organization with a specific focus to provide access to space, access to opportunities for the youth to collaborate, co-create, and work towards sustainable development in South Sudan. The whole challenging environment of 2016, I turned my training to be a free one for the youth to get access to those basic skills so that they'll be able to get into the job market. And initially, the key focus area or the thematic area of the work is to focus on entrepreneurship, peace building, education, and health. Specifically on peace building, we're focusing on mitigation of hate speech and social media incitement that can lead to violence. When the pandemic hit in 2019, there was a lot of fear, and so many communities were getting out of content. There's so many IEC materials that are produced that some of them people interpret it differently. Not long enough, we met with the Attempts agent from Voice Post Organization, and they were already having a prototype of a bus call that they looked into passing out information. So we team up and collaborate together to make it work out. So we're able to reach our network. Majority of those IEC materials are written in English. Some of them are written in local language, which we know the illiteracy rate in South Sudan, which is very high. It's something that so many will not be able to just like read. This is their local language, but they can. So the reason why audio pre-recorded messages is to let most of them understand that this action means this in their local language, and that makes them aware of so many things that's happening. Roughly, we covered the whole of Juba with life-saving information during the pandemic. We were also supporting the frontline doctors. We have a whole range of skills as an innovation space. We embarked on making sanitizers, hand wash, liquid soap, and provide to the military hospital and Al Sabah hospital as part of our contribution to support the frontline workers. And those are all materials that we did it ourselves in our space with a few number of the volunteers. I was once a refugee. That was early, long years, some years ago, before the independence. I think it's good to give back to the community. It's good to value the humanity, the life that is being given for us freely. We're not paying anything for it, so who are we not to give back? So life in a refugee was a prison for me initially. I came to Juba. We were among the first batch of the refugees that were being repatriated to South Sudan, to Sudan in then, not South Sudan. That was back in 2008, 2009. When I came to Juba, I found this freedom. All the things that I was not able to do them, I feel I can do them, when I landed in Juba like that. I found this is home, this is where the freedom starts. This is my place. This is where I can be able to question people when things are not going wrong. This is where I'll be able to pick a bottle of water down and put it where it is needed. This is where I can be able to do what I love doing, to help others and others as well to help me. That is one of the things that makes me started that one right away. One person who also inspires me a lot, Mahatma Gandhi, he said, to the youths around the world, you need to know one thing, that people will ignore you, people will fight at you, people will insult you, people will do all these things, but you should never give up, because always you'll be winning, you'll be in the winning team. That alone tells me a lot. And if you stand in the truth, always the truth will set you free. And I think those are some few motivations that makes me keep on doing what I love doing.
And that is our feature for this episode. Really wonderful work from Emmanuel in South Sudan. Do keep up the great work of spreading the message about COVID-19 and raising awareness using technology. And now we're going into today's discussion where we are talking about using technology to tackle misinformation about COVID-19. And we have our special guest to help us with that, Mr. Achaleke Christian from Cameroon. I'm going to give you the chance to just introduce yourself and tell us who you are, where you're from.
Thank you very, very much for this opportunity. My name is Christian Achaleke, as you rightly said, and I'm from the Republic of Cameroon, and I'm 31. And I actually work in the space of civil society, but wear different hats. And my background is actually around peace and security, and I've been working within this space for the past 15 years. And from Cameroon to the continent and globally. And in 2016, I was named the Commonwealth Young Person of the Year, and I had the opportunity to be received by Her Majesty the Queen of England. And since then, it's been a career of different heights and trying to get things done in the way in which young people should. And so that's basically my work. And my response to COVID-19 came because of the fact that at the same time, young people were being much more worried, and we told ourselves we could come together to respond to the pandemic in the best way we can, so that we contribute in changing the narratives where we are seen as troublemakers always. So, I mean, it came from that perspective. So, and along the line, when I was 15, I met someone who told me, Christian, you have a lot of energy, we just need to see how to, channel this energy. And that was how it all started. So I started using theater while I was in school because I was not very smart academic wise. So I was not passing exams. So I know what it means to be last in class, So, but when I started leveraging on my inner strength, Then that was how I got into civil society, and I grew from a volunteer to where I am today, serving as the executive director of one of the leading youth-led organization, and having worked with the World Bank and other stakeholders as consultant, and currently serving the African Union as one of the African Union Youth Ambassadors for Peace, So it has been a journey, but it's part of me, it's my life, growing from practitioner to research. I also teach in one of the state university, and the whole thing is about the energy and trying to channel it and helping young people to see that, where you're from should not destroy you, but should rather give you an opportunity to become better. And also your past should rather inspire your future rather than, feeling broken and, not knowing when to go to. So, that is actually been it, and seeing how we could help young people not to engage in violence. And that's what brought me to this work, to where I am today.
Wow, truly, truly inspiring. I'm just thinking of a young person in Africa right now who thinks their whole future is just bleak, it's blank, and I'm like, they just need one person to believe in them and actually guide them in the right path, just as you found a mentor who helped you to get to where you are today. So congratulations on all your achievements. So let's dive into the campaign, the initiative that you have been running over the last 2 years of the COVID-19 pandemic in your country. Tell us how it started, what is the initiative really about, and how has the reach of the people you were engaging?
So, interestingly enough, I had no background in medicine, nor in technology. But like I said earlier, one thing which keeps me is the zeal to make something different, to build a change. Because part of my work, I do tracking on social media, misinformation, radicalization, and all of that. Then I realized that Cameroonian communities, especially in local communities, were much more worried about the pandemic because our healthcare is not very advanced. Access to drugs, to medicine, access to even subvention to accompany people was a big challenge. And it was a major issue because at the same time, Cameroonians were comparing themselves with the US, where the US government was giving palliatives and all of that. Now, in our context, there was nothing of that sort. At the same time, access to potable water was a big issue. So all of these challenges made it much more challenging. And that was where we had to give birth to the idea, Operation One Person, One Hand Sanitizer. So I got back to the office that morning. Then I called my colleagues and I said, we need to develop tools to fight misinformation because hate speech and fake news is a key thing around this pandemic. We need to provide PPEs for people for free. I didn't know how we're going to do that, but we had to do it. And we need to start producing ours. And my colleague said, how do we want to do it? Are you a doctor? Are you a pharmacist? I said, I have no idea, but we could bring people together. At the same time, how do we curb misinformation? We started focusing on leveraging on social media. We had to get, young people also who are major campaigners on social media. And we also got to some filmmakers to see how we could use comic relief to be able to support people, because at the same time, people were going through mental health challenges, stress, and all of that. So we started working now on developing a comic kind of TV series to sensitize people and translating sensitization messages into dialects and all of that. So before we could know it, the Cameroonian government got to us and there was an official press conference actually presenting what we were doing as an inspiration to young people. But they didn't give us a dime as cash support, and we were not worrying about that. For us, it was to do the work. It was not about money or anything. And before we could know it, we had produced over 100,000 bottles of hand sanitizer.
Wow.
And give it free to communities. We had produced face masks using prisoners to produce face masks. So as I said earlier, our model was adopting peace building strategies to do that. So using prisoners to produce was a form of restorative justice for communities to also know that despite the fact that someone is in prison, the person had committed crime, but the person is there to save you in times of need. So we produced over 50,000 face masks that we produced, and then we started producing soap and detergents, and that was how we grew, and our sensitization campaign using social media, community engagement, and all of that, we realized that we had reached out to 2 million people across 9 regions in the country.
Incredible stuff. Like, what you're doing is what we hope many of our leaders, our governments, our private sector should be doing. Like, you are truly the epitome of taking up social responsibility. Now, I'm going to just jump to Reverend Anthony Achampong, because you mentioned that this came to you in a dream. And I think that's really spiritual. That's really like a prophecy, you know. Very interesting that you had a dream and then the next day you decided to just run with it. And I want Reverend to just weigh in on that.
Well, Gigi, what I would say is, first of all, let me congratulate Christian for the phenomenal work that he's done. But to talk about him dreaming, it's not out of place. I think God has given us brains. He has given us the capacity to innovate and to invent. It is left for us, and especially the youth, to experiment with the ideas and the thoughts that come into their mind. And I do believe that he took a chance, and bam, there is where we go. So it is an encouragement to all men, women, young, old, and especially Africans to give it a go. Whichever ideas come, and if you know that it will help other people, it will help civilization, help our people, give it a go. And I think that once you start, the support will come. Many a times, people wait for the support when they have no ideas at all. But you have an idea and you believe in your own ideas, give it a shot and look at what he has been able to achieve. So congratulations once again for the work that you've done.
Absolutely. Thank you so much, Reverend. You know, Dr. Mary Ann, it must be music to your ears as a healthcare professional to hear of a young person going an extra mile to make sure that they help in the COVID-19 response, and not just in education, but even in providing commodities such as PPEs, masks, and hand sanitizers. You know, it's just really incredible. You know, maybe you can also weigh in about some of those initiatives that you're also aware of that young people in Kenya undertook.
Yes, Christian, congratulations once again. I'm amazed even by the awards and the Queen of Spain. So I look forward to one day interacting with you and for you to meet the youth in Kenya. Here as well, there's a lot of innovation that's going on, particularly that tackles misinformation. And one of them is using mobile technology. You know, there is a good side and a bad side of a coin. And we've seen that using social media, a lot of misinformation is there. But on the same hand, I'm seeing the youth now and many other people around here using the same social media to actually quiet down this misinformation and give hard facts, hard truth that indeed vaccines are good, what the virus is, etc. And I've seen the youth use the mobile technology to make sure that we have good information out there on Facebook, on Twitter. I've seen medical students take that initiative, having medical camps where they go out there and teach people how to wash their hands, how to wear their masks properly. So again, we can work together as a team. As an African team, I think we can be able to quieten down the misinformation that's there and hit Africa with hard facts and the truth that, again, we can get ahead of the pandemic.
Absolutely fantastic. And I think sometimes with countering misinformation, it's also about the approaches that you use. I was really happy to hear Achaleke talking about how they also use comedy, you know. But now we're going to go for a break. We've had really awesome chats and we're going to conclude this conversation on the other side. But for now, it is time for us to hear what people on the street had to say.
Je me rappelle au début du Covid, nous tous on cherchait un remède. Et quand le remède est sorti, les gens ne le veulent pas. Donc je pense que c'est pas une bonne chose de refaire ce vaccin. Au contraire, les études ont montré que les effets secondaires, mais sur une très petite partie, voire 0,0 quelque chose %, les gens allaient se faire vacciner. Les jeunes, allez vous faire vacciner. C'est pas parce que vous êtes jeune que la maladie vous touchera pas, c'est vrai. propager la maladie à vos parents, à vos grands-parents.
Il y a d'autres qui sont des plus paralysés suite à ça. Nous ne savons pas si ce sont des rumeurs ou c'est vrai. Mais, à vrai dire, ça me fait peur, moi. Ouais, alors, et compte tenu de toutes ces rumeurs, moi je me dis que je ne vais pas prendre le vaccin. Pour moi, le vaccin, c'est quelque chose de pas bon.
Here in Malawi, there are a lot of myths about vaccination, but I'm taking advantage of my profession, be it in some of the programs that I do present. In our news articles, we are trying as much as possible to encourage people to actually disregard these myths and make use of the available vaccines which are being administered by the government through the Ministry of Health here in Malawi.
Welcome back from the break, and that is the word on the street. Remember, today we are discussing using technology to tackle misinformation during COVID-19, and we had really fruitful and inspiring conversations just before the break, and we're going to just wrap up our conversation with our guests, and I'm going to go to Achaleke. You're talking about the wonderful work that you were doing, the materials that you were delivering to people, as well as information. Tell us about the challenges that you faced in that process and how you were able to overcome them.
Challenges are the things which would hardly flee away from, especially the context where we're working in. And one of the key challenge that we were facing as a group of young people was being able to accept that we could risk that much, to save others. It was a time where people were afraid. Even the most important people in the world were locked up. So it was a big thing that we had to accept, that we want to be out there. We were no medical practitioners. I know nothing in medicine, but I saw myself, wearing masks, putting on gloves and getting this done. That was a key challenge. Another challenge which we faced at the beginning was acceptance by the community. We needed volunteers. Producing 100,000 bottles is not a joke. We needed young people to support with putting labels and, carrying and all of that. It was difficult to even get people. They were afraid to go out. Their parents were telling them no, but we had to keep doing. And one of the things that was like the breaking point for these was the success of this. When people started seeing that, communities were happy, people were receiving their PPEs, parents started sending their children to come and volunteer with us. And within this period, we worked with 2,700 volunteers, young people within this period. We saw people even rushing us now to say, oh, we want to do this with you. And the fear was broken. Another thing which we faced was the stereotype about young people. When we started approaching different stakeholders, they were like, oh, it's young people and you are not sure what you are doing. So this stereotype was there. It was a big challenge. It accounted for the reason why the kind of support we got from the beginning was very low, because we had to prove ourselves. And the way in which we were able to combat this was to stay consistent. From 100 to 200 to 1,000 to 4,000. And we even gave donation of this to the government. We said, you don't want to give us resources, it's okay, but we gave them 4,000 bottles, support your own programs. Because for us, it was not just about producing or responding to these challenges, but also to change the narrative. Because at that moment, the high rate of misinformation which we had was flying all over, and we had to change it in the best way that we can. That was our strategy, and we were able to deal with it until date. Some people say our names have been written because we left a mark. With or without resources, I think young people have the power to transform this continent. That was what I learned from this process.
Absolutely, really incredible stuff, and you are really the epitome of the saying that you don't have to wait for the right time, the enabling environment, just do it, get on with it, and then those resources, the capacity that you need will eventually find you while doing something. So I think that's really incredible and inspiring. I'm going to go to Dr. Mary and your last message on why it's important to use technology appropriately appropriately in order to tackle misinformation about COVID-19? Because we're still not out of the woods. There's still people who are spreading misinformation and wrong things about COVID-19 and now even the vaccine. So maybe you can just briefly speak to that, Dr. Marianne.
Misinformation, let's start from there, can be very dangerous and can cost someone's life. So it's very important we verify the information that you're sharing. If you cannot verify it, you don't know the source very well, please do not share because it can cost someone's life. Let's be careful with the information we share and spread the good news.
Thank you so much for that, Dr. Mary Ann. We're going to go now to Reverend Anthony Achampong, your last message on the importance of using technology appropriately, especially when you are raising awareness or sharing information.
What I would say is that, like Dr. Marianne has said, that there is a good side to social media and there is a bad side to social media. And it's all about the menace of misinformation, fake news, especially about COVID, which is the subject of our discussion. You know, our people, a greater number of our people are uneducated, they are illiterate. So to rely merely on technology will be a failed thing. So my encouragement to all, especially those who are listening to this broadcast, is that whatever you think you can do to change the negative stories about COVID and give the proper information that is researched, for instance, going to WHO sites and then taking this information and then disseminating through appropriate platforms will be a great way to contribute to the global fight of the pandemic.
Absolutely. Thank you so much for that, Reverend. And you're absolutely right in saying that sometimes technology can create some inequalities because it can sometimes not be very inclusive. And this is why it's important to include other mediums of communication, use traditional media, use outreaches by going to communities, and most importantly, translating these materials into local dialects if we want to make sure that we are indeed communicating with everyone. Now, I want Achaleke Christian as our special guest today to have the final word. In just a minute or less, I want you to speak to a young person in Africa right now who feels they don't have enough capacity, they are not an NGO, they haven't won awards, they just cannot do anything significant to help their country, their community, or contribute to the COVID-19 response. I want you to speak to them right now.
My words would be, firstly, you need to believe in yourself. Lack of capacity, resources does not define you. I know it because I lived it. And for those who are Christians, I will tell you, God is the one thing that lifts it higher. So be it Christian, Muslim, or any faith, just believe the supreme being has a role to play towards your success. It's no magic, it's hard work, collaboration, consistency, and having people to help you. It's the way forward. That's what has worked for me. Thank you very much, and I hope to connect with you all. Thank you.
Really, really powerful words. This has been such a really enriching conversation. Thank you very much, Achaleke Christian, Reverend Anthony Achampong, as well as Dr. Marianne, for your time and sharing such wonderful and enriching insights. Thank you very much for tuning into Africa Health Check. Make sure you connect with us on all our social media platforms. We will be so happy to hear from you. Until we meet again, same time, same place. Remember that the future is Africa, the future is today.